Welcome to another episode of Preparing for the Unexpected. I'm your host, Alex Fullick, and as always, we like to talk about things related to business continuity, COVID, crisis management, well-being, emergency management, anything that helps you, your organization, or your community prepare for, respond to, and overcome adverse situations. If you'd like to be a guest on the show, please feel free to reach out. You can find me on LinkedIn. I'm the only Alex Fullick there, so I'm really easy to find. A couple of quick announcements. Thanks to everybody at the recent Disaster Recovery Journal Fall 2021 conference. I presented there and I was the master of ceremonies and had a great time. So thank you to everyone at DRJ, sponsors, exhibitors, speakers, attendees, and the organizers. It was fantastic. I had a great time. I will be speaking at the BCI World Virtual Conference, November 3rd and 4th. I am part of a panel discussion and 2 networking sessions, and I'm speaking there. And the Continuity and Resilience Today in Toronto is now 3 days and will be virtual. I know for a while I was saying that hopefully I could just drive down the road, an hour away and be in person, but it's now virtual, November 30th to December 2nd. And I will be presenting there and possibly doing a few other things with the conference, but more to come on that. It's that time again. I'm sure you recognize my guest. She's the bringer of always good news, because we always have such a fun discussion about what's going on in the world of COVID, vaccines, and everything that's relatable to those topics. And welcome back once again, Regina Phelps. Regina, great to see you again.
Alex, it has been so long since I've seen you. I think it was DRJ, as a matter of fact.
Exactly. Yeah, just a few days ago.
Great.
Actually, that's going to be our first topic. During the conference, I don't know if anyone out there knows this, but I found out that Regina had been presenting there for, what did you say it was, 27 years?
27 years, yes.
27 years. Now, I knew she'd been there for a few
Twice
years.
a year. That's 54 times.
54. So that's a lot.
Yeah.
I don't think I've done anything 54 times. So I knew you'd been there a long time. I didn't know it was that long. But I was curious for us to kind of just have a little debrief, touch base here before we get into some of our other topics, is how you felt about the conference, considering you have seen so many different trends and topics come up over the years. What you felt about the last one, because to me, and we'll talk about them, there seemed to be some changes in what was going on, and how you felt about the conference itself.
Well, first of all, it was the first time that you had hosted, so I thought you did a fabulous job, Alex.
Thank you very much.
You're welcome. So this is the second or third DRJ that's been virtual, now that I think about that. Oh my gosh.
Yeah.
I actually think that they have done a fabulous job in doing virtual conferences compared to others that I have either spoken at or attended. I think the platform they use is great. I think the speakers that they have selected have been good. There's a great opportunity for interaction, which takes a lot of effort, by the way, in a virtual space to do that. Well, I think there's certainly a lot that's changed over the many years I've been doing DRJ, but certainly what I'm seeing now is the topics seem to be broader than they used to be. It used to be a kind of a very narrow scope of either business continuity, disaster recovery, and certainly issues related to crisis management, but it's been really narrow, right? And now it seems like it has really expanded, including risk and well-being and things that I would have never seen before, to be honest with you. So I think it's much more interesting. And it really, I think, reflects how our industry is not so pigeonholed into a particular area, is what I would say.
Do you think that COVID obviously has something to do with that? Knowing, because that was one of the things I noticed too, that there were other subjects that might have been hinted at over the years, but now are actually right in the forefront.
Yeah. Oh, absolutely. Absolutely. I think COVID has changed so much of our life. And certainly a lot of the topics that you saw DRJ had some aspects where that was reflected. Absolutely. What did you think of it?
I enjoyed it. And I really echo the comments about interaction. Some of the panel discussions, and even during one of your presentations, it was airing, but you were there answering questions as well, and others people. So you would say something in your presentation, and I would be able to ask a question right then and there,
Right.
and you could answer.
Right.
And I liked that, rather than trying to remember what my question was.
Right.
45 minutes later,
Right.
you said something about, and then we're trying to figure out what was said.
Yeah.
So I really like that aspect. I found, even though everybody was further apart, I found the interaction really good.
Yeah, actually, and I was very surprised with that. The idea that they have different opportunities for you to not only connect with vendors, but to meet other people, to do some networking. I think, and I think because we are much more used to this virtual space that we inhabit now, that people kind of jump in a lot more easily than they possibly did at the first DRJ in March of last year.
Yeah, it's a new field, so you're kind of not sure what to say, where to tread, right? And now it's, okay, well, I can just ask a question right off the bat,
right?
And I know that the speaker is right there answering, so. I like that. Of course, nothing beats face to face. Of course, it's much better to shake someone's hand or whatever the case may be, and share a joke or something that sometimes doesn't come across when you're typing it. Right.
A little impersonal. Right.
Yeah, your fingers don't have the same inflections that a voice does.
Right. So, that's so true.
It was great. I enjoyed your sessions, and
thank you.
I think DRJ did a great job, and I really liked the virtual format. But fingers crossed, at some point we can do
Orlando in March.
Yes. I don't know if I can make that one yet, because I usually focus on fall conferences and do everything in the fall. But I have actually been approached to speak or present at a couple of things in the spring, so I have to consider, okay, do I have the time and resources to do that? Can I do spring and fall? So
of course you can. It
would be nice, bring me back as MC and for Orlando and DRJ, I'll be there.
Mickey ears and all, right?
Yeah, exactly, yes. And why am I thinking of Mickey Mouse ice cream all of a sudden?
Oh, they have a great one with it's an ice cream that's dunked in chocolate and it's on a stick.
Oh, okay. I think somebody's posted about it at some point, because as soon as you said it, I thought of Mickey Mouse ice cream. I went, why'd that pop in my head?
That's it. They're really good ice cream bars. Got to have them.
Well, let's jump in on some of our agenda here. And let's do what we always do and just get a quick catch up as to what's happening with COVID right now around the world. Do you want me to start in Canada?
Start in Canada. Yeah, start in Canada.
Okay. Our deaths are up slightly. From our last talk, I think we had said that our cases had gone up, and probably in 3-4 weeks or so, we'd see an uptick in deaths. And unfortunately, we have.
Right.
So we're at just over 20,600 now. However, hospitalization.
That's since the pandemic began, right?
Yes, that's since the pandemic began.
Right.
So our entire country has less than what's happened in Texas, I believe.
Right, which was 67,000.
Yeah. So hospitalizations, though, across the board are now going down. And case counts seem to be going, in general, they're going down, but in a couple of areas, there's still a few hot spots. And I'll get to those in just a moment. Vaccinations for the first dose, we are over 77%, so 77 plus. And for both doses, we're just over 73%. So they're pretty good. I think what we're seeing now is we're up against that group that doesn't want to get vaccine, and they're kind of what's remaining. We have made progress in getting losing my voice already today on getting vaccines for kids. So that's going to be happening really soon, what the plan is. So all the 5 to 12-year-olds will be getting their shots in the coming weeks. So hopefully that
will help.
Yeah, that will definitely help. In Ontario, the province where I am, we've had a couple of schools that have gone to online learning because they found a couple of cases, but they said that ahead of time. If we find any cases, not certain schools, but these schools will go online because they were before. We're not going to take any chances and keep everybody in there. So we've had a couple that have gone that way now. The province is slowly coming out of all restrictions. We now have, I know I made fun of the application that the government was going to put out that you could have on your phone to prove that you got double doses. That's now available. I still have to download mine because it only became fully available yesterday to everybody. So I still have to do that. But that's now happening. So gyms and theaters and concerts and some of these other places, you have to prove your vaccine status. So that's happening now. So everything, I don't think there are any businesses now that are quote unquote closed. Everything is now slowly opening up, which is great for everyone. So fingers crossed it goes in that same direction. A couple of other not so good areas is the province of Alberta and Saskatchewan both had an increase in cases and deaths to the point, and I think I mentioned this before, other provinces at the time couldn't take any of the overflow, couldn't help out. Well, now they are. British Columbia and Ontario, we've taken people from Saskatchewan and Alberta to help care for them as well, because the stress on the healthcare system in those two provinces just couldn't handle it. The Premier of Alberta seems to be in hot water at the moment with everybody, because things just keep exploding there. And he's kind of one of those people, I want to get everything open, and he rushes too fast. And then lots of people get sick.
We have several of those up here.
Yeah. And, people get sick, lockdowns happen, and then you get even more people angry. So he's creating part of his own problem. But fingers crossed, I've got family out that way, that things turn around soon. And I'm glad other provinces now whose numbers have come down can actually help and step in and help the people of Alberta and Saskatchewan. So I'm happy to hear about that. So that's really where things are in the country here. How about the US?
I'm going to show a deck of slides here just because it's easier for me to talk through some of these things if I can. Making sure that you can see that. Where we are right now in the US is what I would say our usual pattern is, but it's also the usual pattern, frankly, for the world. And that is that we have this dramatic 2 or 3 month surge. And then what happens is it actually then falls off just as dramatically. To be honest with you, Alex, no one really understands why that is. It's not because it's seasonal, because the virus seems to rip through communities in hot weather, cold weather, humid weather, dry weather. It's not seasonality. No one knows exactly why that is. But at some point, the surge drops, and it drops precipitously. So we're at the end of our 4th surge here in the US. Going forward, we're expecting the surges to be less because we're counting on 2 things, both vaccination, and then those people who have actually had the illness have gotten immunity through the infection. And so that will help, unless we get a new variant, which is a whole nother conversation. And you can see our dramatic rises and falls. And particularly if you look at the cases and the hospitalizations and the deaths, actually, we have a great uptick, and then we have a sudden fall off. And that's where we are right now, is we're dropping from the 4th wave here in the US in all indices. But you can still see the US, this is our map, and you can still see that we have places on fire. And this is the other trend that we have. We seem to flip back and forth between north and south. So the virus ripped through most of the southern parts of the United States, Florida, of course, which you heard lots about, and Texas, which still has some places in the northern part of the state that are not doing so well. But now you go to the northern part of the US, right against Canada. I'm so sorry. Idaho, Wyoming, Montana, North Dakota, Wisconsin, Minnesota, all of those places are now seeing a really significant uptick in cases. And Alaska has been a crisis for about 45 days. They are in what's called crisis standards of care, as is Idaho, as is Montana, as is Wyoming, which means that essentially if you have an urgent medical condition, you may or may not get seen. Hospitals are overflowing, and they've already dispatched National Guard troops into hospitals in those states to assist with care. That's how bad it's gotten here in the US. They've done that in numerous places because there's just not enough staff, period. You guys haven't done that, I'm assuming, right?
We did have some Army surgeons and doctors step in to help out in the hard-hit areas. So that obviously helped. Still, I don't believe they're everywhere. They're just in a couple of spots. But I think their participation is being reduced right now. As our numbers come down, we obviously don't need the Army to be involved.
Right, right. So the United States, just to sum up, is actually in much better shape than we have been in some time. Fingers crossed that will continue, but I'm not holding my breath. Globally, I just want to mention just a few things. The world is also seeing a decrease in cases, with the exception of places like Eastern Europe, Bulgaria, Romania, many of those parts, the stands. Russia is having huge numbers of cases and major impacts on their healthcare system. And they have a huge amount of the population that is not vaccinated. I think only 33% of Russia is vaccinated, which is kind of amazing since they had one of the first vaccines, which turned out, Sputnik 5, which turned out to be actually a really good vaccine. But people don't trust it. And so a lot of people in that country have not gotten vaccinated, which is a big problem. And we'll talk more about vaccines in a bit, but so the world is still having these hot spots, and parts of Southeast Asia are still problematic as well. And I think what we're seeing is the same uptick, rapid rise, followed by a sudden decrease, is essentially what we see over and over and over again. And that's probably going to continue until we've got enough vaccine in people's arms worldwide.
Well, correct me if I'm wrong. I think a couple of those far eastern European countries and Kazakhstan and Belarus and some of those areas, they kind of had a denial atmosphere about them as well.
Right,
And
exactly.
recall,
The whole
it's a hoax, or it's not as bad as you think it is, and now
right.
They are suffering.
Right, and many of those countries have populist leaders, which are kind of like, Brazil and Russia, and when Trump was president in the United States, and the guy in the Philippines, Durago, those individuals who have not really promoted vaccine, and they have not certainly promoted that the COVID threat was significant. Those countries in particular have really suffered based on that kind of leadership.
I liked what you said about vaccines or the cases or in general around the globe are going down, because just before we started talking, I don't know if you know this, but I actually sponsor and have for about 12 years sponsor a child through Plan International, and now this is a catalog for gifts for Christmas. You can buy things for them. Well, they've
Good plug.
Yeah. Well, it's charity, and I'm lucky enough to have seen Catherine and Yassini go through, and one is now a teacher, I believe. So I'm quite happy about that.
Oh, that's
but
great.
It added in the calendar now. To your point, you can buy COVID cases and masks and
that's great.
Different kits and things like that. When before it was different packages, but now that COVID relief not activities, but products are now added into there. So hopefully everybody that does contribute can now, for $10 or whatever it is, buy 50, doses type thing for
vaccine. Oh, that's great.
The vaccine. So I noticed that just before we got on air, and as you mentioned, around the globe, I thought, oh, well, that's kind of what I just saw here. So it's the way it's changing. So
that's great.
On that note, we've come to the end of our first segment. We are talking with Regina Phelps, and we'll be right back. Welcome back. Today we are talking with Regina Phelps. Regina, so if you had a crystal ball, what do you see coming in the future?
Ooh, well, that was a good lead in. So what I wanted is I'd like to just share with your audience today something about thinking about the future going forward. And I'm going to present, and I would encourage your listeners to Google. This is US centric. I apologize for your listeners in Canada and elsewhere. There's something called a COVID-19 Modeling Hub. It was started by the CDC, and essentially they take 19 of the premier universities in the United States. So it's like Harvard and Yale and, oh my gosh, like UCSF and Stanford and everybody that's got a medical school and a lot of infectious disease people. And they basically have brought them together. They take all of these different models and they basically boil them into one. And what they do is they always have a set of principles that they are modeling against. So the current model, the current forecast, which is only for 3 months at a time, because to be honest with you, Alex, nobody can actually model this any farther than 3 months. It's just way too many things going on. And what they're looking at in this model is, for example, they're basically taking two parameters. One is the availability of childhood vaccines, not only approved, but given, versus no childhood vaccines. So we're talking about 5 to 11. And the second issue is the appearance of a new variant other than Delta. And so if you look at this essentially window pane, if you will, on the top left-hand side, there's childhood vaccines and no variant. That's the best option. And then on the far right on the top is no childhood vaccines and no variant. So that's not as good, right? On the bottom is that we have childhood vaccines, but we have a new variant. And the one on the bottom right is no childhood vaccines and a new variant, which would be the worst, right? So if you sort of keep that in mind, those are really the things that are really what people are thinking about from a modeling perspective. And this particular model, you'll see that exactly that same window pane I just talked about is now represented in the 4 boxes that you see here. So essentially what you're looking at is the best case scenarios on the top right, which means no variant, but while childhood vaccines are out available and people are taking them. And you can see that the number of cases really, really, really tapers off if that is our future. The worst case scenario is the far right-hand side, which is new variant, no childhood vaccines. And now you can see that we've got almost like a flat line and then potentially the issue going up. Now, when they looked at a variant, they weren't looking at a super deadly variant. They were looking at something that is very much like Delta, which is also problematic. I mean, it's highly infectious, right? But it's not necessarily more deadly, and it's not evading vaccines. So the purpose of me sharing this is that people always ask me, is this thing over with yet? And the answer is it's not. And it's not going to be over, frankly, until everyone is safe. What does that mean? That we have widespread vaccine around the world? Because, the US is only 4% of the global population. You guys must be, 0.5% or less, right?
Yes.
So let's just say that, but if you throw the US and Canada together, maybe we're 5% of the global population. There's a lot of other people around the world that are still getting sick or going to keep getting sick and are not going to get vaccinated for a long time because of the shortage of vaccines. So because of that, this is not going away for any time soon. And that's why it's important to understand these models. The big game changer is this, and that is a variant that could have any of these characteristics. So one that eludes PCR testing, that's already happened once before, Alpha, which came out of the UK. Actually, the PCR test done in the UK is slightly different than the one done here in North America. And when Alpha first came out, all the labs thought that their PCR machines were broken because it did not catch it. And that's because of the change in the protein. And so what we could have is something like that could be even more widespread. So something that eludes PCR testing, one that is more contagious. Delta, of course, has an R naught of between 8 and 9 versus the wild strain, which is the first one that emerged from China, that has an R naught of 2 to 3, which means I can affect 2 or 3 people. Delta can affect 8 or 9 people. But the incubation period of Delta is essentially half of the wild strain. So it could incubate for up to 10 days in the original strain. In Delta, it only takes 5, which means essentially generationally, it's as bad as measles, even though the R naught is not as high. It can also, another game changer would be something that could reinfect people that have already been infected. So you've had COVID or you've gotten the vaccine and it actually is able to infect you anyway. And the one that's probably the most concerning would be one that actually eludes vaccines altogether, like Beta did with AstraZeneca in South Africa. South Africa had bought AstraZeneca as its vaccine, but then when they started doing the testing in the field, they realized it didn't work at all against what they had circulating. The last one, which is probably the least likely, is one that's more deadly. And the reason it's the least likely is that if you're really, really deadly, then you kill off all your hosts, and it's not a great way to continue propagating your species. And so a really deadly virus is not one that's going to spread as far. But those are things that would really change our story going forward. I'd like to talk about endemics, epidemics, and pandemics. Are you guys talking about endemics at all in Canada?
I haven't
Are you seeing
anything crop up about it? No.
Okay. Here in the US, I pick up so many publications. It could be the Wall Street Journal, it could be you name it. And they're talking about, oh my gosh, COVID is almost endemic. And so these are three terms that are important to stop and reflect on for a moment, because eventually this is what you're going to be hearing about in Canada. And if you look at just at the actual pictures that go with the globes that go with the different words, you'll see endemic. There are little kind of dots randomly around. An epidemic where all of the dots, which means all the illness is concentrated in one area. And then a global pandemic, which means that we have these big clusters, but they're everywhere. So let me just peel this back to you. There is no transition. There's no like a line in the sand that says we went from one to the other. So it's not like we're going to go ding, 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 ding. You know, it's now an epidemic instead of a pandemic. That's not how it works. It's simply just linguistics. It's all words. So a pandemic is a global epidemic. And what does that mean? It's in a wide region. It has multiple continents worldwide, substantial number of people. We've been living this for 20 months, so we know it well. An epidemic is where it's actually a large number of people, but it's concentrated in a geographical area. So think of the flu, for example. We can have an epidemic of the flu, and it might be Canada or it might be the United States, but it's not the globe in its totality. The word endemic, which is now becoming very popular in the press, is very, very different. It means that the infection is kind of at a baseline. It's always out there. It's always around, but it's present in what we might say are expected numbers, our usual numbers, and it does not severely impact healthcare. So an endemic virus is something that's out there all the time. People may occasionally get sick. You're never going to get rid of it, like we're never going to get rid of COVID, but we are certainly not endemic yet, because we have certainly, just if we talk about the United States, we have epidemics everywhere in this state, in this country.
So how do we know when we are in an endemic?
Endemic. So yeah, all the terminology, right? What will happen is that the impact of healthcare will really drop down. There'll be little outbreaks that occur kind of here and there, but nothing big. It will not strain our healthcare system. It will be kind of a baseline. We'll expect to have, X number of cases. Maybe in the States, we might be having, I don't know, a few hundred cases in the course of any given week, let's say, but not the number that we're at, which is about 1,700 a day. So it will get down to a low enough level, it becomes manageable. We're not manageable now. And it's impacting still work locations, business, all of that. So we're all still a long way from that place. So an endemic is where it's like this, an epidemic, which is really what we are here, a global pandemic. An epidemic is where we are right now. And so you might start seeing that term in Canada. It's used a lot now in the contemporary press here in the United States, and it's wrong.
Mm-hmm. Yeah, I haven't seen it crop up here yet.
Yeah.
And maybe that's because of the politicalization sometimes of COVID. Yes, some people up here like to make it, political, but not to the extent that happens down in your parts of the world.
Yeah, we are just, oh my gosh, I don't know what to say about us sometime, but it's painful,
Well,
painful.
we have bad stories too, and I forgot to mention this earlier on. About 2 Fridays ago was in Ontario, walk your child to school day.
Hmm.
So a lot of parents were taking their young kids to school, which was great.
Yeah.
And unfortunately, some of those anti-vaxxers were picketing and yelling and screaming at the parents and the kids. And you saw, some of these poor kids being picked up by their parents who were in fear, which I thought was absolutely disgraceful. If you don't like the vaccines, that's one thing, but to yell and scream at, a 5, 6 year old, no,
That's ridiculous.
that's unforgivable in my book. That's unforgivable.
Mhm,
And
mhm,
so there we have those bad elements up here too.
mhm.
And yes, you can send me emails. I don't care.
Yeah, I get trolled a fair amount myself, so it's all good. It's all good. It's all good.
Well, with the crystal ball, I want to just stay on that. Are there a couple of other things that we see potentially happening over the next 6 months to a year?
Mhm,
Things like mental health
mhm,
issues. Recently, we've heard it's happening here in Canada as well, but 4% of workforce in the US leaving
mhm.
their jobs. So are there a couple of other potential, what do we want to call that kind of thing, events that
Mhm.
we're going to see over the next little while?
There are three that I think are really paramount. The first one is the Great Resignation, which you just alluded to. The Great Resignation here in the States is reaching a fevered pitch. So what that essentially means is that people, for example, during the course of this pandemic, let's say that they were approaching retirement age, maybe they're in their 60s, and at some point they just said, enough, I'm done. And
Yeah.
so many of those people have left. And even people that were well into their retirement age but still working were also thinking like, I'm out of here. So that's contributed to a lot of shakeup in the employment situation in general. The second is the issue related to the inflexibility of employers or people asking them to come back and they don't want to come back, or I want to keep working remotely and they're not being allowed to. So there's the inflexibility, and especially, to be honest with you, Alex, I really see that in people that are under the age of 40 who, going to the office has certain benefits, but it also is a big pain, right? You got to drive, you got to, just do a lot of stuff. And so I think that has been a huge issue contributing to that Great Resignation. And then I think also, frankly, there are a lot of jobs here in the US, I do not know about Canada, where they're lower paid jobs, and they put up with a lot of junk, right? I mean, I think it's people that are in service work in hotels and restaurants, and and some places in the United States, they just get a tiny bit of money because they're expected to make their living off of tips.
Yeah.
And and it's been dangerous, it's been difficult, and so a lot of people aren't going back to those jobs. And there's a lot of jobs that people say it's too hard, or I don't want to do. I mean, they're like hard labor jobs, etc. So people are like saying, okay, enough, I'm out of here. And so the Great Resignation is having a huge impact on the US. So that's the first thing. The second thing is long COVID. So long COVID is going to be the big ticking time bomb for healthcare worldwide. And I'm going to explain a tiny bit about this at the very end of our talk today about ACE2 receptors and why long COVID is such a big deal. But it's going to be from a perspective of impact to productivity and healthcare costs and a shortening of life expectancy. It's going to be a huge deal. And that's going to go on, frankly, Alex, for a really long time.
Mhm.
And then the third thing really is mental health, which is, I think we were kind of afraid already, to be honest with you. And COVID has really sent us, at least here in the States, over the deep divide, in which people are really struggling. And in our contentious environment politically anyway, it's already difficult. And you see a lot of that in both the contemporary media and social media. but I am really concerned about mental health. In fact, I was reading the Wall Street Journal this morning, and there was an article in there that just blew me away. It was about TikTok and young teenage girls who, this is so bizarre, have started to develop Tourette's syndrome and tics in their face from long exposures to TikTok videos and the mental stress that it causes them.
Really? I hadn't heard that.
Unbelievable. I thought, no, this can't be going on. And they documented all these neurologists and pediatric neurologists and others who have been seeing young girls coming into offices with facial tics. And when they're asked what they're, what do they do? And they watch TikTok videos for hours on end, and they must be holding so much stress in their face that it actually causes them to tic. I mean, it's like, really? Wow. How could we have gotten to this point in our life?
Mm-hmm.
So I think those to me are the three big things that are, and many of those, frankly, maybe probably all of them have really long-term implications for our society.
You touched on a couple of things there that when I'm in the car going to the park with the dogs and things like that, I'm always hearing different things. And some restaurants now are closing 2 or 3 days permanently during the week because they can't
get staff, right?
Yeah. But they're finding out that some of the staff aren't coming back because, as you said, they don't get paid enough, or they're expected to live off of tips, but yet the restaurants aren't accepting 100% capacity yet. It's 50 to 75 or something like that now. And so they can't make that money.
Yep.
So again, they're not going to come to work because they know they're not going to have the customer base that they normally have to make that money.
And they have exposure in that job.
Yeah, and the exposure. And then that's affecting their well-being and mental health. So you're finding out that it's all connected. And then when some of these people that are in other jobs are saying, I can't make ends meet by doing this. It's well known that people want value from what they do, and they want to feel valued. Mm-hmm. And when you have, during break, I mentioned this, with the supply chain issues that we're experiencing, there are a couple of, I think it's Toyota plant that went down and closed, for a while because of COVID, opened back up, had 2 shifts. Well, now the supply chain issues are now going back to 1 shift. So all these people are now feeling completely, of no use, hey, I'm just a thing to everybody. And now they're feeling the mental impacts of that. They're leaving their jobs as well, to use your term, the Great Resignation. Now it's like, I've had enough of this. I'm not a yo-yo, a toy to be played with. Mm-hmm. And I think a lot of the ones that you just mentioned, they are all related. It doesn't matter which direction someone comes at from, the other two will come into play at some point.
Right. Yeah, I think the ones in particular, I mean, I'm concerned about all three of those, mm-hmm. but I'll tell you the ones that concern me the most, frankly, is the long COVID piece, which has a very long-term impact on people's health, but secondarily is the mental health issues. I think our mental health was pretty frail already in the United States for many, many different reasons, but COVID, I think, has really pushed us over the edge. And for a lot of people, they are really, really suffering. And there's not sufficient even mental health services or mental health professionals to really take care of all of those people who have a really significant need.
Mm-hmm. I agree. It's, I don't want to say I'm fearful of what's going to happen over the next couple of years, but I think there's a lot more mental health stress and issues out there than what people want to admit. Mm-hmm. A single mother may say, she's under stress because she's got children, but you add COVID to that, and it's even worse for her, right. Or a single father, or, a young couple, or whatever, mm-hmm. or even grandparents taking care of their kids that all of a sudden had to come home because they lost their jobs. Yeah. I think a lot of people don't want to admit that, they're feeling stressed and feeling overwhelmed, and, and it's a little scary to know that we might see some of this, mm-hmm. but there's a lot more behind the curtain we can't see.
Right. There was an article, it was in the news last week about over 170,000 children have lost their primary caregiver, whether that was a parent, a single mom, let's say, or a grandparent who might have been their primary caregiver. And this is in the United States. Over half of those were people of color. And you just think of a young kid, right, who loses their primary caregiver in the middle of a pandemic. They have no, immediate. And so that's an example of that kind of deep, deep pain that will go on for that person's life, right? And the impact that they're going to have not only themselves, but then their immediate circle, and then, and then the circle beyond that, and ultimately society as a whole. So I think the impacts of the pandemic will be long felt way after it's over.
For years to come yet.
For years to come.
Yeah. And on that note, we've come to the end of our second segment. We are talking with Regina Phelps, and we'll be right back. Welcome back. Today we are talking with Regina Phelps. Regina, I have a question for you. What are your thoughts on mandates, specifically mask mandates?
Mask mandates. I'll talk about mask mandates, and vaccine mandates. I am a huge fan, frankly, of mask mandates. And I think there's been so much science. There was a big study in Bangladesh done that was released, maybe about a month ago, talking about, and it was well documented, and the huge difference of even wearing simple cloth mask. Obviously, the best mask you can buy is the one you really want to have on your face, but even a cloth mask will be effective at least slowing down some transmission. I think the mask mandates are less onerous or less problematic than the vaccine ones, which is where I really would like to spend some time talking about. And I'm going to share my screen again. I don't think, again, you and Canada have, this is probably less of an issue than we have here in the States. But as you might know, President Biden actually has got a OSHA emergency standard coming out that will come out in the next few weeks. And maybe even as soon as next week, mandating vaccines for employers of over 100 individuals. And so this gets into, how do people feel about this? Overall in the United States, when people are polled, roughly, in the mid 60s, people actually approve and favor the vaccine mandates. About 23% disapprove. And the mandates that have happened so far, and that's been in hospitals, in healthcare systems, in city, county, and state governments, roughly about 1% of the people who are mandated to get the vaccine will quit, even though at some point it could be 20 or 30% that may say, I'm never going to take it. But when push comes to shove, so far, that's been around 1%. Now, that may change again with different workforces in different parts of the country, but we'll see. What I want to talk about is this emergency temporary standard that OSHA will be putting out. So this is applicable for your folks in the US that listen to you, but frankly, also any place in the world where mandates may be coming, or you might decide as an employer you wish to mandate it. I want to talk about some of the things that people should be thinking about now. So here in the United States, as this slide talks about, is that very likely there'll be all kinds of legal challenges, but no one is expecting any of those to actually stand. Biden has the authority to direct OSHA, which is all about workplace safety, to actually release and enforce this emergency temporary standard. So I want to talk about the 7 steps that people should think about to get prepared for. And so I know in Canada, you don't have this yet, but you may at some point, or you might even have it in a provincial situation. So here in the US, who's going to be required to have this emergency temporary standard in place will be any private employers who have more than 100 employees. And that's 100 employees in the payroll, not just, 100 employees that show up to your office. I actually did a training about this for one of my clients today, and they said, well, is that the number of people that show up every day? No. It's how many people you have in your totality. And so essentially what they're obviously looking at, they're not looking at the small kind of mom and pop business, but what they're looking at is anybody who has a, sizable workforce, right? Now, this is really important. I don't know what's going on in Canada, but what we're telling all of our clients is this is the time to survey your employees to ask them about their vaccine status. Now, sometimes people in the United States will say, well, I can't do that because it doesn't meet HIPAA requirements, which is a Health Information Protection Act that we have here in the US. That is not true. You as an employer here in the US can actually survey your employees and ask them what their COVID vaccine status is. The reason this is important, Alex, and think about it from your perspective in Canada, if you're an employer and you're going to start requiring vaccines, it would be really good if you knew right now, before you actually did that, how many people are vaccinated. Are we talking about 5%? Are we talking about 50%? You know, it's a big difference in how you're going to be planning for this and what you're going to be doing and so on. So you got to ask people, and many people are really uncomfortable about that. But you as an employer here in the United States have the right to ask that question. Do you know if employers in Canada are asking about vaccine status?
I've heard mixed, I've read mixed things. Some places are, but then there's a lot of pushback saying that they can't do it. So it's right now, it seems to be a bit of a gray area. But I really think some people are asking anyway. They're just doing it in different ways. You know, there's always a way around something.
Right.
So I think it's happening. It's just, you know, the way it's happening sometimes isn't getting advertised, you know, how they're going around it.
Yeah, I think here in the States, again, if you're trying to decide how you would handle this, if you have more than 100 employees and you're trying to decide how you would handle this issue when this emergency standard comes out, is that if you don't have a sense of how many people are vaccinated, you just don't even know what to plan for. And so an employer really needs to really take this opportunity to ask. It will help you make a decision about how you're communicating, how you would talk about testing, how you would keep documentation, just a bunch of things. So really encourage that employers ask that question. Here in the United States, I don't know about in Canada, that one of the ways that you cannot, employers have an option. They could say, you have to be vaccinated, period. Or you have to be vaccinated, or you could do a weekly test to determine whether you are COVID positive. Now, here in the United States, testing goes in spurts and valleys, if you will, between where you can get a test result back really quickly and other times where you can't. And so if you're all of a sudden have to have a lot of people being tested every week, you need to understand what that means. You know, how long, you know, and really think through what that means. Okay, I got tested on Monday. My results come back on Tuesday. Well, great. Well, then I know pretty soon. But what if my results come back on Thursday or Friday? And so what day do you want people tested? And, you know, how long would you wait? And you have to really think through all of that. Here in the United States, we're now pushing out more home testing, which is one option. But also, if you're getting a PCR test, it goes to a lab, you know, that could take, I don't know, in Canada, it could take 48 hours or it could take a week, which is crazy. How long does testing take to get back from you guys?
It's been the same. You know, I know some people who got their test results right away and others, you know, up to a week. So it's been the same. And I think it has something to do with the amount of tests all of a sudden that come through.
Exactly right.
Fewer, they get them faster. If there's a whole pile, it takes longer.
Right. And there's already been conversations here in the US that if they all went to laboratories, there's just not enough labs to potentially take all of those tests in on a weekly basis and get them back out to an employer in a timely manner. And so that's a big concern and a big issue. Another part of the temporary standard will be that there should be considerations for time off. And so, as you might remember, I can't remember, did you have side effects after your vaccine? I don't remember.
I was just tired tired the next day. That was it.
Yeah, for most people, that's the case. You're kind of tired. Sometimes your arm hurts. Some people, though, really actually get a fever and have more significant symptoms. So one of the standard requirements is that the employer has to be able to offer paid time off if people actually end up having symptoms and can't come to work. But then the standard isn't clear. Well, we don't know yet, but when it comes out, it could be just saying that the employer has to give them paid time off that they may already have in their bank, meaning that I get so many days off a year, I have to tap into my own bank, although some employers may offer that on top of their existing bank of time. That's not known yet either. This is an important issue about remote workers. So if you have remote workers, they will not likely be covered under the standard if they never, ever, 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 ever come to work. But it has to be never. Not like I come to work every once in a while, because if I come to work every once in a while, I count as an on-site worker, at least sometimes. The number 6 here is really important. And I would say this for all of your listeners anywhere in the world, frankly. If you're thinking at all about vaccine requirements or testing at all, or how you're going to manage employees related to COVID, it's really important that you think through every tiny bit of a policy, and you need to be working on it now. So many of my clients are all saying, well, no, I want to wait. I want to see what, no, start thinking about this now, because this is a lot of stuff to chew on. So for example, what kind of documentation are you going to require for a vaccine? So you mentioned an app that you have for your province. I have an app in California, but most states do not. So that means you have that little flimsy, CDC card, which you could buy on the internet, but that's, what do you do about that? How do you require proof of testing weekly? What do they have to give you? How do you submit that documentation? Do I email it to you? Do I, what's the procedure for that? And then how do you store it? And how do you retain it? And how long do you retain it? What's the timeframes between, for current folks to get vaccinated or new hires? So for example, you might say for new hires, I'll only take vaccinated people. Or for people that are currently under employment, you're going to give them X number of days to meet the standard, right?
Mm-hmm.
How do you accommodate religious or disability accommodations? Now, this is actually kind of an interesting one, but for religious accommodations, there is currently no organized religion, Jewish, Muslim, Christian, Catholic. None of those faiths have actually said that you can't have the vaccine. But there are lots of smaller churches who have decided that that's against their religion. And so that could be an option for some people if they don't want to get vaccinated. There's also a disability accommodation. Now, technically, legally, if you will, the only true accommodation for disability is if you are actually allergic to any of the components of the vaccines. However, there are lots of doctors, apparently, that will write all kinds of prescriptions, if you will, saying you can't be vaccinated, from chiropractors to you name it, selling these disability accommodations. Do you guys have that going on in Canada?
Yes. Yeah, there was a news report about a month and a half ago. A doctor was writing, for a fee. It wasn't even meeting people. All you had to do was call, and I guess all his secretary or he would do is take the name, fill out whatever form it was, and send it back to wherever they were calling from. So there was no actual doctor consultation, and I think he wasn't actually really a medical doctor, but he was a doctor of something, and I can't remember what it was. So he was able to do it.
A doctor of something. Oh Lord,
which was crazy.
Yeah, I guess that kind of insanity is worldwide, not just here in the U.S. Sometimes I just think we're the only crazy people, but it's nice to know that
we have our share.
Yeah, I'm glad to know it's not just us, actually. The last thing is that looking at a policy is that you'd have to have a clear step is if employees fail to comply with the requirement, exactly what your process is up to and including termination, so that people understand, I don't get vaccinated. This is my road that I'm now getting on. That's really important that that's super clear, so nobody's not clear about what the expectation is.
That one is actually happening.
Oh, is it?
Yeah, I can't remember. It's in Toronto, either school board or one of the transit authorities have said that if people aren't vaccinated by, I think it's the end of this month, you're gone. You've had your warnings. You've had ample time. You're done. Plain and simple. There is no arguments. You're let go.
Yeah, and that's it. And it's like, I think it's what's important is the employer has to be super clear, right, and state it up front so that everybody knows and there's no surprises. And I think that that's really important. The last of my 7 steps that people need to really think about if there is going to be a mandate is that this is the time for you to develop employee communication. And what I've been encouraging my clients all along is to really talk about COVID with their employees, such as on that first bullet, where can you get a vaccine? All the different, so if you have multiple offices, you should have links to drugstores and, health departments, wherever it is that they can get the vaccine. That should be really, really clear. Where they can get testing and how that's going to work. You might be really clear and upfront. We're going to implement this, and if this is not going to work for you, this is maybe a time that you should start thinking about looking for another job, because once the clock starts, you're going to be out of here. And this also then, you can also, when you do a survey, for example, and find out who's vaccinated, you can then share that with employees. 98% of our population is vaccinated, or 75%, or whatever the number is. So that way that people can see, it's not just me, and that can be helpful as well. So all of those things are really important for anybody who's deciding or thinking about a mandate as you go forward, wherever you are in the world, of course, working with laws that are particular to your region or location, but that's important. What I'd like to really end on, because I know we're getting close to the end of our time, is to remind people one really important thing. COVID is an aerosol disease, right? It's aerosol disease. It's spread through talking, breathing, coughing, etc. It is a respiratory illness, but it affects almost the entire body. It affects any area where there is what's called an ACE2 receptor. The coronavirus, as you well know, has these little spikes, right, all around it. That spike actually plugs into an ACE2 receptor. And as you can see from this list, oh my goodness, like almost everything. So starting at the very top, the oral nasal pharynx, all the mucosa in your nose and in your mouth, all the way down your airway, the nasal pharynx, the lungs, the stomach, the small intestine, the colon, the skin, the lymph nodes, the thymus, bone marrow, the spleen, the liver, the kidneys, and the brain, which explains why long COVID is such a big deal. What's not here is the pancreas, but there was a study that just came out last week about diabetes being now a secondary long COVID infection. People with no history of diabetes, but their pancreas shuts down because of COVID. People going on renal dialysis, people having all kinds of intestinal problems, people having kidney failure. It's a big deal. And so what I would ask all your listeners to think about is that this is an aerosol respiratory disease, but it affects a huge number of organs in your body, and it is not the flu. And so what I would say to everybody is, I know that we're really tired of this and we've been doing it for 20 plus months, but we still have to keep working to protect ourselves. And so because it is a respiratory aerosol infection, it's all about ventilation, 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 ventilation. And as we get into the winter and the cold months, and everybody's going to be in homes and huddled together, if these are people that you don't know, if you're going to go to restaurants or anything like that, ventilation is the number one deal. I cannot emphasize that enough. I also want to really encourage your listeners to be wearing high quality masks. Cloth masks were great when we had the wild virus, the original virus from Wuhan. It's not so effective against Delta. It's better than nothing, but I would certainly get a surgical mask or a K95 or an N95 as appropriate. Really, especially during this winter period, really avoid indoor gatherings, especially if you do not know the vaccine status of the people that you're with, which for me personally rules out going to like a theater. I haven't been to a theater in 20 months, and restaurants and things like that, because I just don't want to be hanging inside a building with people who I don't know what their status is.
Yep. Agreed.
Physical distancing, right? Always important. Getting vaccinated, yes. And hand washing is good, but it's not the way it's spread. It's an aerosol-borne disease.
Yes. Well, you
So
were
those
just
are my
full of great news this week.
yeah, I know. Well, what can I say? What can I say? Yeah, I think it's really important that sometimes we just forget that this is the basic thing that we have to be kind of going back to, right?
Yeah.
And this is going to get old. It's going to go away at some point, but we're not done yet. And I hate to be the purveyor of bad news all the time, but we still got a ways to go, my friend.
Yeah, I think I'm hearing, next summer is when we could have kind of officially say pandemic is over.
Yeah, I mean, that's our
but-
best shot, I think.
Yeah, but there's still so much to happen. And, even if the COVID part might be declared over, and we talked about it, there's going to be other things that are occurring as a result of it.
Yeah.
So we've got years to come yet
Yeah.
before it really is over with a capital O.
Yeah. I think what we have to do is we need to really just keep our guard up for this fall and winter period, because it could continue to be not to the extent it was before there was a vaccine, but still can be problematic. And we have certainly seen here in the US, we have big pockets of unvaccinated people remaining, and that's all it takes.
Yeah, and look what happened last winter.
Yes.
That
Oh my
was
God.
a huge spike everywhere, here in Canada as well. In Europe, US, you name it, it was a huge spike.
Mhm.
We don't want to go through that again.
Nope.
Lessons learned. Come on, right? We got to learn from this.
Yeah, absolutely.
So on that note, Regina, always a pleasure chatting with you once again. One of these days it will all be good news and we'll be able to change topics.
I can't wait. I can't wait.
But until then.
Until then, here we go, right?
Yeah. So thanks again for sharing your time and all this information for us. I really appreciate it.
You're welcome. As always, it's great to be with you, Alex.
Great to be with you, and everybody listening and watching. Stay prepared, everybody. If you liked that video, thumbs up. If you didn't like that video, thumbs down. But leave a message and let me know what your thoughts are. If you'd like to be a guest on the show to talk about something related to business continuity, disaster management, COVID, personal well-being, anything that's relatable to those subjects, you can reach me through my LinkedIn profile, which is in the video description. And of course, don't forget to subscribe. In the meantime, stay prepared, everybody.